former Florida State, former NFL player, drafted, I think, by the Titans back in 2010 out of Florida State. He's now Dr. Myron Rolle, who joins us on the program. Doctor, how are you?
I'm doing well. Thanks for having me, Dan. I appreciate it.
If you can give us an idea of what the last month has been like, and compare that to any other month that you would have on the job.
Wow, it's been intense. I'm just coming off a 24-hour shift, but our hospital has been transformed. When you walk in, it's almost like an airport security line where you have to have a mask. Everyone, regardless of your position or title within the MGH Mass General Hospital community, you have to wear this mask. Our hallways are bare now because the visitor policy has been restricted. You can't have any family members or any visitors. Our outpatient clinics are now done all virtually. We'll call our patients with results of CAT scans and let them know that we have to reschedule their cases because the operating rooms are canceling elective cases. We're only doing emergent or urgent cases. Our neurosurgical floor is transformed into a COVID-19 only floor, and then there's this surge clinic at the hospital within a hospital to sort of offload some of the heavy influx of patients that have come off the street with COVID-19 or symptoms analogous to it. So, as a neurosurgery resident, I went into this passion of mine to operate on the brain and spine and the peripheral nerves. But now myself and my colleagues, we've been redeployed and redistributing our skill set, I guess, or just our time and our energy to helping fight this COVID-19 effort or this COVID-19 issue that's happening. And it's a hospital-wide approach, and it's vastly different than what we've seen in Boston. It's going to get worse probably in the next week or two. So we're preparing for even more challenging days ahead.
But you go to med school for neurosurgery, but now you're doing something with a virus that, it feels like you're going back to medical school, but you're doing it in real time with real patients with lives on the line.
That's right. And, I would say that it is a change-up, certainly. There are some crossover traits between COVID-19 and neurosurgery. For instance, surgeries that happen near the sinus, through the nose, transsphenoidals, anything that can sort of aerosolize particles, that can potentially infect us as neurosurgeons. We use a lot of electrocautery and high-speed drills in our cases, and that has been shown to maybe aerosolize some of the body fluids to potentially infect us. But you're right. At baseline, we have to learn not new, but sort of relearn approaches to affect change in this upper respiratory illness. But I think to our advantage, we're a teaching hospital, and we have wonderful medical doctors, infectious disease doctors who are really, really stepping out front and helping us sort of manage that learning curve a little bit so we can kind of come in and not have to do anything truly outside of our scope of practice, like intubating somebody emergently, but, be able to handle some of the more fundamental aspects of their care. And it's really just about manpower right now. The personnel, we need it at the hospital level, and we have to be able to adapt and adjust.
We had Tony Baselli on, the former NFL lineman, Hall of Fame finalist last couple of years, and he contracted the coronavirus. And he said, I'm alone in a hospital room, and I'm thinking, is this where I'm going to die? Like, going to your job, you're seeing people, we're seeing this in New York where, the medical staff has to almost choose who they can try to save and who they can't. I mean, how do you process that, Doc?
That's very difficult, and it's even more difficult when, as Mr. Baselli said, when you're alone, when you don't have your family around because they're just not able to be there based on the hospital's policy. These end-of-life and goals of care discussions are happening over the phone, and you're like, man, this is unbelievable. But I will say that, these patients have, as you know, a lot of them do, have comorbidities and pre-existing conditions that already put them in harm's way and make them very high risk as a subset of the demographic. And when this COVID-19 hits, it sort of sits for a little bit, and then maybe after day 5 or 6 or 7, it quickly decompensate. So it's challenging, and I hope that these stories that we're hearing, that anecdotal stories that you're hearing, allows people who are maybe not connected to the healthcare industry or not connected to the hospital world can see that this is serious, this is real. Stay away from those beaches that you're going to as convenient. Stay away from those highly frequented places that are just full of people, and really do your part as a normal citizen, sort of affect change in your lane, because that's important for all of us to do.
He's Dr. Myron Rolle, Neurosurgery Resident at Harvard, the Massachusetts General Hospital, a Rhodes Scholar, former NFL safety. Was it sixth round by the Titans? Does that sound right?
That's correct. Sixth round. Yes, sir.
Okay. How close were you to staying with football?
Very close. I played football my whole life since I was 6 years old. My father is from the Bahamas. My parents are from the Bahamas. And, they started the American Football League back home. And when we came to America, football was a huge part of my life. And my cousins, Samari and Antro, played in the NFL. I went to Florida State because Bobby Bowden had a pedigree of putting guys in the NFL, Deion Sanders and Leroy Butler, and, all these great athletes, great corners and great safeties. So when the decision had to be made whether I was going to stay, continue to play, or move on to this next career, I prayed about it, talked to my family and friends, and realized that practically I made enough money to pay for medical school. Also, my hands were still healthy enough to actually operate because I always wanted to be a neurosurgeon. And I didn't have any concussions or traumatic brain injury that would prevent me from thinking, clearly as I went forward in my next career. So I made the tough choice, went ahead and went to medicine, and it's been a blessing because now I'm able to advocate now for football as well in the concussion spectrum, but then also be able to take care of people who are very sick, like moments like this.
How concerned are you that you're going to contract the coronavirus?
I'm very concerned, and we all are, certainly. I try to protect myself every time I go into a patient's room. The thing is, coronavirus doesn't just hit one patient, and that's like the only pathology or malady that they have, right? So if they call us as a neurosurgeon, this patient may have a brain bleed or a brain tumor or a tumor in their spine or some sort of neurosurgical disease burden, but they also have COVID-19. So I walk into these rooms and I try to protect myself as best as I can. I go in, get my physical exam quickly, get my history quickly, be efficient, get all my tasks done so I don't have to re-enter the room 5 or 6 or 7 times to potentially infect myself. I got married 4 months ago, and I sent my wife down south to be with her sister. So I'm trying to make sure I'm not bringing anything home to her. So I'm just trying to make adjustments in my own life so I can be able to protect myself and protect the people around me.
Being in neurosurgery, I'm curious about the future of new helmets in the NFL, concussions. Has the NFL asked you about this, or looking for you to advise in maybe how we make a new helmet that can protect the brain even more?
They have not asked me. I would certainly love for them to do so because I love the sport so much. For sure, I wanted to stay around. It's helped me so much. It's helped my family. I'm using the traits that football taught me as a physician, and anytime I mentor the young kids from Florida State who I talk to, I tell them that if you have interest in science or medicine or just helping people, really think about being a physician or a physician assistant, nurse practitioner, nurse, something in healthcare because the crossover is just really seamless. But I would certainly love to help partake in new technology and new ways, innovative ways to find out how to make the game safer at all levels, particularly in young football, young leagues, Pop Warner, and the youth football leagues, because I think that's where it really starts. You sort of have this buildup of chronic hits to the head that maybe just gets illuminated once you get to the high velocity impacts of high level college football or maybe professional football. But I think it starts young. So if we look back, kind of go upstream and try to figure things out that way, we might be able to rectify the situation and keep the game safe and preserve it.
You're kind of a show-off here. 4.0 grade point average in high school. I think you had the lead role in Fiddler on the Roof, the musical. You go to Oxford. You're a Rhodes Scholar. You're kind of a ball hog, Doc. Come on.
Well, it's a blessing for sure. I did not sing well as a white Russian Jewish milkman, but it was a lot of fun.
We found something you don't do well. Thank you. Go get some sleep, and we appreciate what you're doing. Thank you, Doc.
All right, thanks, Dan. Appreciate you.
That's Dr. Myron Rolle.